This is the third head-to-head randomized controlled trial between two drug-coated balloons, the Passeo-18 Lux of Biotronik versus the IN.PACT Admiral of Medtronic. And we noticed very clear in this BIOPACT study that there is no difference between both balloons, and in terms of the primary efficacy endpoint, freedom from TLR, we reached 97%. In terms of primary safety endpoint, completely equal results. And in terms of one of the secondary endpoints, primary patency, where we reached an 89% in the Passeo Lux group and a 90% patency at 1 year in the IN.PACT Admiral group. The choice is, of course, depending on a lot of factors. Each drug-coated balloon stands for its own data. And so we need to have this particular data of the particular drug-coated balloons. And then, of course, beside this, there are other criteria that are deciding about the use and which one to use where. I'm thinking on the available sizes, lengths, diameters. I think on the economical consideration concerning reimbursement. These are for me the leading factors beside, of course, efficacy and safety data. I think having head-to-head controlled randomized trials is very important, and we don't have a very good tradition in the vascular peripheral world to do this. I think in cardiology they do much more these kind of studies. It is important because, especially for drug-coated balloons, but I can say the same for bare metal stents, whatever, there is no class effect. So every device is standing on its own data. And we need to see these data and randomize towards one of the competitors. That's the way to go. It offers you a lot of information on efficacy and safety. There are different important parameters as outcomes in this study. Of course, the healthcare providers are interested in freedom from TLR. I think that's the reason that it is the primary efficacy endpoint in this study. The less the patient needs to come back to the hospital for re-interventions, the better. Also for our patients in terms of quality of life. Of course, for doctors, if you want to judge a particular technology, you need to know about patency. So for me, personally, also the patency, a 90% patency at 1 year with these type of balloons is extremely important. And then the safety, I don't need to tell you about our paclitaxel gate started in the end of 2018. So the more data we have available to show the safety of this kind of technologies, the better.